Hi, my name is Wendy Hayden, and we're going to talk today about low tone or hypotonia and how that can be a root cause or a contributing factor to chronic constipation. So we're going to talk about it in regards to your child, but potentially this could be something that you have also had that could have contributed to your constipation if you've had lifelong chronic constipation. But today we're going to focus on children, but it would all be relevant for an adult as well. So the first thing to look at to see if hypotonia or low tone might be an issue for your child is how do they crawl? And my son, both my sons actually had this strange little crawl where they would have one leg up and they'd kind of pull the other leg through and scoot sitting up on their bottoms. And it was adorable. My grandmother recognized it from when my mom was a baby, and that's how my mom apparently crawled. So apparently my mom also had low tone, and it's a sign of low tone. Army crawl is another sign that your child could have had low tone. So if they had a crawl other than a traditional crawl, that they're using the crawl in a different way to support their weight because they're not strong enough in their abdomen to be able to just have a normal crawl like a child, most babies do. So that is a very strong indicator that low tone is an issue. If you have any of these signs of low tone, you will want to get a referral to an occupational therapist to get a diagnosis, a formal diagnosis. In our case, the occupational therapy was not covered by insurance and it was expensive. So I learned to do a lot of things for my son at home to work on low tone because it was just a much easier way for us to be able to afford the things that he needed and be able to do them regularly enough for him to get all of the benefit for that. So if your child has articulation issues, that is a sign of low tone because their muscles and their mouths are not forming words properly because they're just not strong enough. Delayed turning over, delayed sitting up, delayed crawling, delayed walking, those are all signs of low tone. So if your child was very late to walk or very late to sit up, sitting up especially, they have a hard time, holding themselves up and developing that core strength. So if your child had any of those things and they're struggling from chronic constipation, then it's a real good sign to you that this is probably something that you need to focus on and work on. So what my occupational therapist had us do at home, and obviously you need to talk to your occupational therapist and your pediatricians and try to find out what's the best for your child. I'm not a doctor, I'm not an occupational therapist, I'm just a mom who has struggled with low tone and constipation with my child. So what you want to work on is, one of the first things is to relearn crawling. Apparently the crawling really works a lot of different synapses in the brain and gets the child so that there are other things going on other than just movement that happen when a child crawls. Plus it works on core strength. So one of the things that you want to do is work up ways to get your child to crawl in like a traditional crawl. So they're not doing army crawl or any of those types of crawls. So my occupational therapist threw down a bunch of like bed pillows basically on the floor and had him crawl across it, did races with that, had him sit on pillows so that, it's an unstable surface where you're kind of constantly having to correct to be able to sit up straight. So you can do those sorts of things with your child, and you can get really cheap bed pillows at Walmart or order them off Amazon and throw them down on the floor, challenge your child to how fast can your child crawl across the pillows. And this works for younger children. At a certain point, your child's probably not going to be willing to do this. You're not going to be probably able to do it with a 15-year-old, but you can try. So you want to work on those kinds of things. Like I said, sitting on the pillows helps to work on stability and working that core strength. You can also get occupational therapy places will sell what's called a wobble cushion. I got these for both my kids, and you can either put them under their feet at the table or at their desks. And it's like a thin disc, like kind of this, that's round, and you inflate it with air, and it's almost like a balance ball, but it's small, and they can sit on it. And when they sit, they're kind of almost having to always correct. And so that's a good thing to work on. Balance ball chairs are great. So if you get a balance ball or one of the balance ball chairs and your child can sit on that, bounce on that, that really is very good for core strength. A beanbag chair is another thing that's good for working on core strength, because you're still not having to sit in the same way, so you're working different muscles. We hung a swing in my son's bedroom, and it's like a cocoon kind of swing. We got ours from IKEA. I think it was about $60, and we hung it from the ceiling in his room, and he can sit in it. He can read, constantly, once again, correcting and working out that adjustments to work on tone. We have a swing set outside. We have a swing with a set that we took the swing off of, and we put like a hammock chair in that he can sit in or read or play with. So those things are super helpful. Amazon has indoor jungle gyms, basically, that you can hook over your door jamb, and it'll have like a trapeze or a swing or all sorts of things. It's for littler guys, and it goes up kind of like a push-up bar on your door jamb, and you can put that in, and they can do all sorts of different activities inside. Our absolute favorite was a mini trampoline. The mini trampoline, they have them for little guys that have a handle that they can hold on to, or you can get the kind that are like an exercise trampoline, and your child can bounce on it. It's great for kids with sensory issues, bounces. And often a child that's struggling with constipation, when they're using the trampoline, we used to joke that it would bounce the poop out, because shortly after a nice session of bouncing, have to run to the potty. So those are good things to look for as well. Therapeutic horseback riding. My son's been doing therapeutic horseback riding for 4 or 5 years now, and it's great for core strength, working on sitting up and holding their seat. And if you talk to your child's instructor about low tone and those issues, and that's something that you really want them to work on, just horseback riding on its own is going to do that. But you're going to find that it's probably more of a struggle for a child with low tone to be able to get in their seat and to sit properly on the horse and all those kinds of things. So it's just something to alert your instructor to, that is an issue for your child. Let's see, I'm trying to think of some of the other things that we've worked on. Hiking, walking, any of that kind of stuff that you're doing movement and things, and working on core strength and working on pelvic floor strength and things. So what happens is, if you don't have the strength to be able, the muscle strength to be able to push the stool out, what happens is the stool just kind of sits in there, and the longer it's inside, it gets dry. And then it's harder and harder to push, and you've already got a child that's struggling because they don't have the muscles in their pelvic floor and their abdomen to be able to help work that through and push. And so it just becomes a cycle, and it gets harder and harder and harder. And now you're dealing with constipation that's brought on because they aren't going enough, and it's a bad cycle. So some of the things that you can do to get them to go and make it easier to go: magnesium. And I have a video that I'll link to about magnesium and how to use magnesium to help your child have a soft, easy to push out bowel movement. Coconut oil is another great thing that helps lubricate the stool, makes it easier to push out. With either of those things, you're basically taking enough of it until you get to bowel tolerance. I have a recipe for, I call them my poop candy, chocolate poop candy. I've got different flavors of it. And the poop candy is basically just a way to get your kids to eat lots of coconut oil. And it's a good fat for them. It's great for their brains. And it also works by coating the stool and making it easier to push out. So it's really important to figure out, when your child is constipated, why they're constipated. And hypotonia or low tone can be one of the root causes. And my son, it was one of the causes. It was not the only cause. So we had to work on lots of things other than this, but this was a huge clue and a piece of the puzzle of what we were able to do. If you need more help, my book, What Your Doctor Didn't Tell You About Childhood Constipation, works on helping to develop a regimen to be able to get your child to go to the bathroom every day, and then work on, why is your child struggling with constipation? Is it hypotonia? What are the reasons? What other reasons could it be? Especially if you're working on hypotonia and you feel like you're getting really getting somewhere with that and you're still struggling with constipation, it could be just one of the problems. It may not be the only one. So it's just something to look for. Please subscribe, and I have lots of information that's going to be coming up on my channel of different things to help you or your child with long-term chronic constipation or short-term constipation if it's just an occasional problem. I thank you very much, and I'll talk to you again soon.